May I come in? Hey there, how's it going? Welcome back to the clinic. I'm Dr. Nathan. It's great to see you again. I believe you were in here just a few months ago. Fantastic, fantastic. Well, how are you feeling? No, I'm sorry to hear that. You're having some difficulty with your eyes. That's great, that's great. Well, let me just glance at your previous records here. I see. So last time you were in here for your blurry vision. We may want to recommend you to an optometrist. I have some great recommendations on that front. But let me just get a little information about what exactly are your symptoms. As you can see here, I just need to fill out this form and have you fill out a waiver or two here. Thank you so much. So I do have some of the basic information here. Yes, of course. I'm going to help you out because I know that you're having, again, some sensitivity there. There we are. Okay. So, what's your cell phone number, just in case we need to reach you? Okay, great. So, it's a bit bright there, isn't it? Why don't you just go ahead and sign this waiver here? You can just sign here. Thank you so much. Great. Thank you. Okay. So, what we're going to do is just, again, a fairly detailed eye exam, but again, we may need some specialized equipment, and I'll send you to a referred optometrist to do that. Perhaps get you a prescription. So, let me go ahead and put this down here on my workbench, and we'll take a look and see what we can find. Now, do you want some water or anything before we begin, or you're going to be okay? Great. Great. I'm going to start off here with my reflector, because I think I'd be able to just see something here. I apologize, my hair is a bit crazy there. So I'm going to also be testing your hearing, because often those problems can go hand in hand. So we'll just do a basic hearing test just to make sure there's not multiple symptoms here. So what I'm going to do is I'm going to go ahead and just gently take this light here, and I'm going to move it around here. This will help just with the basic sensitivity, and then we're going to do this tuning fork here, which I'm going to use to test your hearing. So we'll do a few hand tests, and we'll start with the light to begin with. So if you could just go ahead and just follow this light here, I'm going to move it back. There we go. You're doing great. Move it the light here this way. There we go. I'm just moving this around here. Yeah, there we go. Great. Let me just get a closer look here. Okay, if you could just go ahead and focus on that light there. It's a bit bright, I know, but try to do your best. Okay, great. Just tracing this around here. Okay, great. Fantastic. That's really, really great. Let me just go ahead and do another test that I think we should just, before I write down any data, I like to just do a sort of a bilateral test here. And I'm going to go ahead and once again, I'm going to take the light and I'm going to just have you. Okay, just want to make sure I can see the pupils there. Okay, fantastic. Now, I'd like to perform what is known as the wiggle test. So, I'm going to go ahead and move my reflector here. And let me set it down on the table real quickly here. I'm going to do the wiggle test here. And again, I'm trying to just get a baseline for, just to see if, what the basic problem is with your eyesight. Now, I'd like to say that it's important for us to also see if there's any systematic issues as well. So I'd like to take your temperature and, of course, some just general readings. So next, I'm going to be performing the wiggle test. And also, I'm going to be holding up a couple numbers, which I'd like you to repeat. So we'll start here, and just want you to follow along with your eyes here. There we go. There we go. What number am I holding up there? Okay, now I'm just going to move it back here. Okay, great. Okay. What number am I holding up now? Okay, I'm going to move this a bit close here. Okay, fantastic. Okay, now I'm going to hold up the other finger here, just wiggling here. Okay, great. That's just testing again your just field of vision there. And now I'm going to hold up another number. Okay, great. Now, here we go. How many is that? Great. Okay, I'm going to move this a little bit forward here. And there we go. Okay, fantastic. And that's 2. All right, great. So why don't I go ahead and just run some basic diagnostics here, and I think that'll help us get a good baseline. Let me step over to my table and grab some tools here. Of course, let me put on some gloves, of course, so we're going to be getting a little more involved here. Very, very important. There we go. Okay, so let's go ahead and take a temperature here. We have this device here. Just turn this on real quick. There you go. So just give me a moment here. Okay, 98.8. Okay, so that's a little bit in between, so not necessarily anything of concern. Those kind of discrepancies can happen. Okay, so next I'm going to go ahead and just ask you to say ah, please. Okay, great. There we are. Fantastic. Uh-huh. Oh. Thank you so much for that. I'm going to just write down a few notes. So, okay, great, fantastic. So I'm going to put this down again. I want to go ahead and take your blood pressure real quickly here. Just good to get a baseline here. So I'm just going to put this on here for you. Fantastic. Okay. Just lift your arm for me, please. Okay, fantastic. All right, so here we go. I'm just gonna gently pump this. All right. Okay. Fantastic. That's within the range of normality. Great. I'm just going to go ahead and put this here. Okay. So now we have this tuning fork here. Now, this I'm going to use to just test your hearing and also vibrations as well, because sometimes if there's a co-infection, again, we can pinpoint where the problem is. So I'm going to take this, I'm going to hit it on my hand, and it's going to vibrate in the tone of C. So tell me if you can feel this, okay? Here we go. There we go. And do you feel that? Great. Okay. Let's try it again. Feel that? Great. Okay, fantastic. Now I'll try one more time. Great, okay. So I'm going to put this down and then I'm going to take your, just listen to your heartbeat real quick for any irregularities. And we'll do a quick measurement. Just going to write some things down and we can discuss some potential treatments. Okay. If you could just go ahead and just lift the shirt here real quick. Okay, just gonna give me just one moment. Okay, that sounds normal, no irregularities. Let's try one more spot here. Now, just if you could just cough. Okay, fantastic. So there's no irregularities there. And that's good news. So I'd like to do a quick measurement here just to make sure when I send you to an optometrist, we'll have accurate measurement, because I do think it's a possibility you could use some glasses or contacts. Because there are no other systematic issues, so that's the good news. Now, if you already have them, then this will still be useful information. So I'm going to take this device here, and as you can see, this is going to line up. And you can see kind of here how I'm going to use it on you, and it will just line up, and you can measure the distance between your pupils. So if I could just go ahead and use this real quick. Here we go. Just in the off chance that this might be something more systematic, I do want to take a sample here. So, just a moment here. Here we go. There we are. Okay. Just here. Okay, so I have my eye chart here for you to read. As you can see, there's 11 different lines I'd like you to go ahead and just read each line independently, one at a time. And we can get a good sense about whether this is eye strain related or something more systematic as well. Okay. Let's start from the top here. Line 1. Great. Line 2. Line 3. Great. Line 4. Line 5. Line 6. Line 7. Line 8. Line 9. Line 10. I know it's a bit difficult. Do your best. And line 11. Great, okay. Great, fantastic. Okay, fantastic. That's great. So we're done with the eye test here. And now I'd like to run another test. And lastly, I'd like to perform the cotton ball test. So I'm going to take these soft, fluffy, white cotton balls and just tell me when you feel this sensitivity test here. Here we go. Feel that? Okay, great. You feel that? How about that? Okay, great. Okay, fantastic. So now, we are on to our final stage here of this exam. I believe I found the problem. So to begin with, I'd like to see you for an appointment again. How is sometime in August? How about the end of August, the 25th? Yes, 11:45 a.m. Dr. Nathan follow-up. And again, I'm going to give you a recommendation for a further test with a very highly respected and trusted optometrist as well. So I'm going to go ahead and give you this card here. As you can see, it's for the 25th. There you are. Thank you so much. And now I'd like to just put that there for you. Put down some notes here. Okay, some findings. Now, essentially what I've found here is I'm just going to prescribe a round of antibiotics just to be safe that there's no systematic problems. I did, just in case there's some eye strain that may be unrelated to some, that might be something else to look into. That is why I'm prescribing you or referring you to an optometrist, and I would like you to follow up with me at the end of August. I'm going to go ahead and just give you a prescription here. Antibiotics, Dr. Nathan. There we are. Now again, you can go get this filled at CVS. I'm not sure. Is this the one in particular you had? Okay, so I'm gonna just do 1, 2. And there we are. So I'm just gonna put this over here. And finish the notes. And then I'm gonna see you on your way. If you could just sign here. That's great. Thank you so much. Yeah, of course. Yes. Now, just want to write 1 or 2 more things here. Okay, fantastic. So, this isn't something I think you need to be very worried about. Again, we just need to keep an eye on it. Make sure it's nothing systematic or anything of that nature. And if it isn't, after after this round of antibiotics you're still having trouble, I do think we'll go ahead and just send you to this optometrist. And again, I'd like you to check in with them to set an appointment because it can take quite a while to get in to see them. Great. Okay, let me put this down here. And it's been a pleasure as always. I'm Dr. Nathan, and I look forward to seeing you for your next visit. Take care.